You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor. I'm a mother of four, and I am a Teratogen Information Specialist. So that means what I do is give people information about exposures during pregnancy, during breastfeeding, before pregnancy, and in cases of adoption. And when we say exposures, we mean anything. So it could be a medication, it could be a vaccine, it could be alcohol. There's lots of different things that can be exposures. And we get questions about all kinds of things, even things that you may not even think to ask about. For example, on today's show, we are going to talk about acetaminophen. And we have the perfect guest expert to talk with us today. We are happy to welcome Dr. Sura Alwan, a Canadian research scientist who serves as the co-director of TERIS. Now, TERIS is a resource that healthcare providers use to look up information about the risks of medications and other exposures during pregnancy. Sura holds professional positions at the University of Washington and the University of British Columbia in Vancouver, where she lives with her family. And Sura is a member of MotherToBaby and the Society for Birth Defects Research and Prevention. Sura, thank you so much for being with us today.
Thank you, Chris, for the wonderful introduction. I'm glad to be here.
We are very glad to have you. I have all kinds of questions on what we consider to be a common exposure, but let's start at the top. What is acetaminophen?
Right. So acetaminophen is the generic name of what we generally refer to in North America as Tylenol, which is its brand name here. It's an over-the-counter drug that is indicated to relieve pain and to reduce fever. So it's generally used to treat many conditions like headaches, body aches, toothaches, and the common cold. And there are also so many prescription and over-the-counter medicines that contain acetaminophen as a component in them. So some cold or flu common brand names include NyQuil or Dayquil, Robitussin, Benadryl, Sudafed, etc.
So acetaminophen is in a lot of different products, and that's important to think about when you're taking different products for different reasons. So Sura, what is a common dose recommendation for something like acetaminophen?
And the maximum recommended dose of acetaminophen is 4,000 milligrams in one day. And more than that, it could actually harm your liver. And if the person is pregnant, that of the baby as well. So it's important we keep that in mind because taking more than one medication that contains acetaminophen at a time may increase a person's chance of taking too much. So I urge pregnant women and everyone to carefully check the ingredients of other medications and add up the amount of acetaminophen in the medication to make sure not to take more than the recommended dose.
I think that's an excellent point. Reading labels is definitely helpful because, number one, typically we take what we need in order to treat our condition. So we typically don't want to take things that are extra. And you're right, keeping that amount in mind. And of course, if you have questions about the amount that's right for you, talking with your healthcare provider. Okay, so it is common, and actually it's been around for quite a long time, relatively speaking, but recently acetaminophen has been back in the news. Can you speak to us a little bit about that?
Yes, indeed. So a growing number of studies, and specifically a recent review that was published in the Journal of Nature Reviews and Endocrinology, raised considerable public attention, claiming that prenatal exposure to acetaminophen may alter or change fetal development and increase the prevalence of certain neurodevelopmental conditions and reproductive disorders in the instance of mothers who took acetaminophen regularly during their pregnancy. Now, those neurodevelopmental issues that have been assessed included common conditions like attention deficit hyperactivity disorder, and a broad range of other cognitive and behavioral outcomes. Reduced IQ scores, deficits in executive functioning, and delays in early communication and language development. However, not all studies reported such positive associations, and it's important to keep that in mind. In fact, many others did not find an increased chance for harmful effects on the children's learning, behavior, or development. But the authors of this article still issued a precautionary statement that acetaminophen and acetaminophen-containing products should not be taken by pregnant women, which I believe is misleading. But this is not just my own personal opinion. This issue has been a subject of considerable academic controversy and media attention, and by that I mean it's been a controversial subject between researchers in the same field. The problem with this precautionary statement is that those studies reported in this review do not really show or give us a causal link. This means that there isn't enough evidence to say that taking acetaminophen causes those behavioral or cognitive concerns. There just seems to be a link between the two, but no evidence of a direct relationship. And another problem with those studies that have claimed such associations is that they lack information on other factors that may be related to both why mothers were taking acetaminophen in pregnancy in the first place, and other genetic factors related to our neurodevelopment that may be passed on from mothers to children. And one more thing I wanted to mention is that neurodevelopmental disorders in particular are very difficult to assess and to associate with a single cause, because the brain doesn't stop developing until 15 months of age after the child is born. So the children may get exposed to variable other factors that may potentially lead to such issues.
So the experts looked at the study and decided to write letters because what they think based on the data available is different than this caution statement saying that people who are pregnant should not take acetaminophen.
That's right.
So, Sura, with all of that being said, you know, how there's two schools of thought here and a lot of back and forth about the data, what is the take-home message for people who are pregnant and using acetaminophen? Like, I can remember during all 4 of my pregnancies, you know, I had been pregnant through different seasons and things like, you know, cold and flu had come up, and, you know, my healthcare provider suggested that I use it to lower my fever, for example. But with all of this now, what are the recommendations for people who are pregnant?
So I agree with you, Chris, because in both of my pregnancies, I have to say I took acetaminophen for several reasons. I mean, who doesn't get fever or doesn't get headache or whatever? So I want to say that acetaminophen remains to be considered by most healthcare providers the main pain reliever of choice during pregnancy because of its safety profile. However, as with all medications, it is best used only when indicated or needed and at the lowest effective dose following consultation with a doctor. So my bottom line would be to reassure pregnant women that they shouldn't be afraid if they ever use or have to use acetaminophen during their pregnancy.
And in the next episode, we're going to talk more about the use of acetaminophen in pregnancy, but also about its use in breastfeeding. So, Sura, I would like to officially invite you back next time to talk a little bit more.
I'd be happy to be there. Thank you, Chris.
Oh, my pleasure. Thank you for being here today. And thank you to all of you, our listeners, for joining us for another episode. While we are done for today, make sure you tune in next time to hear what Sura has to say about acetaminophen in breastfeeding. And that concludes this episode of the MotherToBaby podcast. As always, thank you so much for joining us. We're always happy to have you with us. And again, stay tuned for all our future episodes. You can find us on iTunes or wherever you listen to podcasts. Don't forget to subscribe so you never miss an episode. And you can always go back and listen to previous episodes of our podcast. And of course, MotherToBaby is always available to take your questions. So if there's something that you want to ask, you are free to contact us. So you can call us at 866-626-6847. You can text us at 855-999-3525. You can visit our website at MotherToBaby.org. And from there, you can chat with an expert. You can find our fact sheets, our information pages, our baby blogs, and our podcasts as well. Or if you want to email us a question, you can contact us. Our email address is contactus@mothertobaby.org. If you have an idea for the podcast or want to be on the podcast, we want to hear from you. So please feel free to email us. So until next time, please remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.